I'm Dr. Bill White again, and I'm going to talk to you a little bit about palatal separation. I'm a member of the American Orthodontic Society, and I think palatal separation is one of the neatest things you can do in orthodontics. It helps people so much to restore the breathing and kind of pick up a problem that they had from youth of mouth breathing, and you can get people back functioning normal. And over a long period of time, a lot of the vertical height of the face, you can get it to go down in some pretty bad cases if you get them functioning right. But it takes several years, or it has taken me that long to get them that way. Anyway, I've started this palatal separation. One thing you do not want to do, it's not a bad thing. I bonded a block on top of the separator, and I did it with we had a lot of composites that I wasn't using, so I just put some composite on it, and that was a big mistake. I'll show you what it took to get out of this problem after a while. It took me at least 2 to 3 hours, so grinding a couple hours anyway. Anyway, here's a young lady that we're doing this on, and there's several other things I'd like to touch on in here. We did this slicing technique on her to get her teeth in. As she grew up, we reduced the deciduous cuspids and did pulpotomies on them, and got the 4 anteriors of her lower straightened out. And then we had to do the second phase of this reduction, where we took the second deciduous molar and did a pulpotomy on it too to get that through. I'll show you that on the x-rays when we get through. We've got a slight increase in the vertical dimension of the face. It doesn't look bad at all. It's just very, very slight. But when we look at her models, you can see where the tongue has been in the bottom arch too much, and it has spread the lower arch out wider than the upper arch. And when you see this, you just almost know they've been breathing over their tongue. In other words, if you breathe through your mouth, you've got to breathe on top of the tongue. You can't breathe under it. And so that happened here in this case. So you'll see that as we go through. I don't have all the slides here, but we'll show you enough to see. She's got a nice smile line, a pretty little girl, and to my memory, she was a very good patient. Here are the models. When we started it, these models were taken in 1985, you can see, and we've got a crossbite. See, the lower arch is spread out wider than the upper arch, so that means the palate is probably pointed up there sharper than it should be, and it should be spread out. And you go in on these kids that have been mouth breathers too much, and their lower arch will be wider than their upper arch. Now, a lot of times they'll shift their jaw, and they'll run their jaw over to one side, and they'll have a unilateral crossbite, but it's nearly always a bilateral expansion of the lower jaw that causes this. Now, if they do it a lot, I've had people where the upper teeth just virtually went inside the lower teeth, and you'd have to do a lot of spreading out and increase to get the airway back up here. There'd be tongue thrusters and different things where you've got to correct this tongue problem, but you need to get the airway corrected so you can correct the tongue, the swallowing deal. So it all is kind of tied together in here. And I found that if kids nurse a lot when they're young, up to their 2 or 3, close to 3 years of age. If they do a lot of nursing, they breathe through their nose when they're nursing, and that it makes the airway develop. The pressure of sucking the air in and out while they're nursing causes the palatal area of the airway to develop really good on these people. And I've seen a whole school was that way in Africa. I think I told you that in other videos, so I won't have to elaborate on that too much. But anyway, if they breathe over the tongue and the tongue stays in the bottom, and you get these wide lower arches. I don't think it's quite as much on the other side of the mouth, but we've got a crossbite over here. See, your upper molar should lap over the lower, something like that, to keep you from biting your cheeks. Now, I was a mouth breather and still haven't been able to get rid of it. I still breathe through my mouth an awful lot, and so my lower arch is wider than it should be, and I bite my cheeks all the time. It's been a mess, even at my age. So if you can correct this on somebody when they're young, that's really good. So you can see this maxilla is too narrow. It should be, well, the lower is wider than it should be. So when you go in here in palatal to separate this, I put bonded some material on top of that so it would jump over easy, and it also having that bonded material keeps it from erupting more and keeps you from developing a more lower third of the face height down here. You don't want to increase that, so you put these blocks on top of this. Now, if you go in and bond on top of your palatal separator, you need to do it with some soft acrylic. These light cured acrylics are good for that. You can go in and you don't have to do much etching. If you've got any grooves in the molars and bicuspids up there, you just bond on top of it. And then when you get ready to take it off, you just cut right down the center of it. And you can almost see through the material, tell when to get, so you don't cut the teeth at all when you take it off. That's another thing we're bringing out in this video. So you can see the crossbite on both sides of the mouth. And then when you look at the palate, see, this is not a palate that is expanded out and everything by the tongue. If it was, it wouldn't have these ridges down in here. The tongue doesn't get up in here enough. If it did, it'd have more of a shape of the tongue in the palate there. So you can just look at a model and tell a lot of what that person is doing or has not done, and figure out things that you're going to do just actually looking at that. But I like to sit down and talk to my people when I start to find out really what we're doing, and I always check to see if the TMJ is functioning correct and make some record of it. That's good. Now you look at the width of this lower arch. It's really spread out a little bit more, but if I can spread the palate and get it to jump over and then get the child breathing and functioning right, the lower arch will just kind of close back up. Now when you put a palatal separator up above, it forces the tongue down in the bottom, and the lower arch will expand some from that too. So you have to keep that in mind when you're doing the case, you see. Now here we've bonded this on. You see that acrylic and stuff? This is I think this was the one that I did where I had a lot of concise, which is a real tough composite, and I put it on top of the teeth. And I'll tell you, I've worked and worked and worked getting that stuff off the teeth. So don't do that. If you can just put soft acrylic, and you can go in and you don't have to lap it over the brackets or anything else. I've got bands on these teeth, you see. And you don't have to lap it over. You just put it right on the top. You don't need it pulling over like that to keep it from coming off. It won't come off. Even the acrylic won't come off. I've never lost it on there. Just regular light cured acrylic do that. So anyway, we separated that like that. And here the lower arch. Now you see we've done this reduction of the deciduous cuspids in doing this. And now we've got a cuspid coming up in here, and we're going to have some added room for that cuspid. So in this situation, we extract the first deciduous molar, and then we go in and take off a portion of this second deciduous molar, but leave enough for this bicuspid to come through here, see. And we take this off, and then we go in and do a pulpotomy down both of the horns and the root. And you can leave this root down here. It won't hurt. As this tooth comes up, it'll resorb the root, but it can't resorb the crown when it gets to the crown. So this is that slicing technique, and we've got a lot of stuff on that for you to look at other videos. We wrote an article on this back in 1970. I was doing this and was getting a lot of criticism from my buddy orthodontist. Didn't care for me to start with, and so I just did a table clinic in it and won it. And then I had to speak on that the next year to the whole dental society for half a day. So I really that's where I got started lecturing. Anyway, you don't if you learn how to do that, you can bring most teeth in the mouth without a whole lot of problem. But here we've got a functional breathing problem, so we're going to have to tackle that as you do your palatal separation. And when you get somebody breathing through their nose, it makes a big difference in their life. The fact that the sinuses send nitrogen oxide, just NO, into the airway system, it helps everything, the lungs, the veins, the heart, and everything is helped by breathing through the nose. If you can get them functioning correctly, that's a big thing that you want to do. And palatal separations have been a wonderful way to get people back to the normal functioning and get them breathing right. And I have never found anything really bad about palatal separation as far as people bleeding or something like that. I have never had any trouble, and I've separated people for years and years, and they've never had any trouble with it, you see. Okay, let's go on to now. Let me go jump too far. Now, we took this thing off. I don't show it right here, because I'm going to run through these models, and I'll show these are the models we took in 90 after we took this thing off, and that we got it separated. You see, we've got the uppers up over the lower, and the lower will come in a little bit usually, but I like to get it plenty wide. I wouldn't mind getting it wider than that is right there. But This is 1990 now. We got that wide enough, and you see the difference in the lower arch. Now it has gone back in, and so we're doing this slicing technique to help get the teeth in. We got room for the bicuspid now, and we got room for this second bicuspid to come in right here. And so when this goes, the second bicuspid will come in, and we'll get the teeth in class 1 relation. This is the 6-year molars up there now. Okay. Now here was the separator, and we put this concise, I think what it was, on here. And this is the wrong thing to do. And I didn't need to wrap the teeth up with it either. I could have just put a little strip down the center. It would have done the job, you see. And we separated it, and we had this for them to chew on, and they kept the teeth from erupting into the mouth, and it opened the airway good, and each teeth was so rigid in there. When you separate it, it carries the roots and everything. Now, I dislike these separators that have it attached to one tooth and just a bar pushing these out. Your other teeth lean in. You push the crown out, the roots tend to go lingual. They do not accomplish what you want them to do. So for God's sake, don't use these palate deals that just push on the teeth. Have something rigid on there so that the tooth moves out bodily and the roots get out there, and leave them in for several months. I keep the palatal separated in usually 6 or 7, maybe 8 months, and they chew on it. And if the tooth leans at all, the lingual cusp are hitting harder than the others, and that pressure on the lingual cusp tends to bring the roots out to the buccal, and that widens your airway. And that's what you're after. You're trying to get the airway out. And it's not just moving it out so it's occluding properly, but it's so that the person can breathe properly. And that's what we really need. And it's getting children in function. Now, we have so many allergies these days, and that's a real problem with it. Now, I went to take that off, and I tell you, there wasn't any good way. And I piled that stuff up on the bracket table after about 2 hours of grinding to keep from grinding on the permanent teeth, on the deciduous teeth. I didn't worry about getting it all off, but I tried to get it all off. But I had to cut everything all to pieces to get it. So don't bond anything on top of that palatal separator that's going to be like a good composite. In other words, just take some plain old acrylic. It's pretty soft. It's light-cured acrylic, and do it. And that was one thing for bringing that out. Now here's the young lady. Got just a little bit excess vertical height. In other words, this distance from here to here is a little more than from here to here. And she still looks good, but you get much more down here, and the person, it really ruins the appearance of the facial structure to increase this. Now, she looks pretty good, but really that's on the edge, and you don't want to increase the vertical dimension of this lower third of the face. It really messes up the person's smile and everything in there, so try to correct that. And if you have to send them to an ENT person to get the whatever's wrong in there out, the tonsils, adenoid tissue, sometimes the turbinates are too big. I had an assistant that never could get breathing right until she had the turbinates reduced in size, and then she was able to breathe good. I've had several of them that I separated their palatal. There's one in here that we did when she was 32, and she told me she could breathe. The first time she had never had anything done to her teeth for that long. And then getting her functioning correctly, she looked so much better. About 15 or 20 years later, her vertical height had gone down. I don't know how many years it takes, but when you're swallowing right and biting correctly and breathing and keeping your mouth shut and all this, you lower the vertical dimension of your face to what it's normally hoped to be. Anyway, she looked so much better about 10, maybe 15 years later than she did when we were working on her. Okay, this young lady's got a nice smile line. Everything's good there, and we spread her upper teeth out. Now here, I'm going to show you what we did as far as the second phase of now the first phase, we cut the cuspid off like that, you see. You leave the root in there. People say, well, I'll just extract the cuspid. If you extract the cuspid, you take the root and all of it out of there, and all these teeth will tend to move forward in here, and you will lose arch length if you extract the cuspid rather than reducing and giving these four. Now this Panarex that we glued together, that's just ignore these teeth here. This is the central and the lateral. The central and the lateral, just ignore that. And the further back in there, the more this shows up. And I put it together on the upper centrals. But we reduced that cuspid, and this lateral just moved right in and took up that space. And this is a wonderful thing. You can almost bring a lot of people in, and they won't need any orthodontics, you see. Now on the second phase of it, you go in and take the mesial part of this second deciduous molar, and then you go in and go down the horns of the pup on that. And that gives you room for the cuspid to come up here, and then your bicuspid will come in here, so you'll have a bicuspid right in this area, and your cuspid will come in, and it'll back in up, and it'll be in the other area. And you can bring that in with no problem, and it'll look almost perfect when you get through. I've got a lot of pictures and slides on this stuff, so you can look at those if you're interested. Now, let's see. Okay, here it is later, where we took that out. We banded the 6-year molar, and I sent this young lady to the old surgeon to get the lower wisdom teeth removed. There was no room in here at this point. She's age 15, and she's not going to grow anymore, and we've got everything coming in, and we'll come in and take these bands off. This will come right on up in here. There'll be plenty of room for it. I had the oral surgeon also, I talked with him, and I had him uncover this 6-year molar, the second molar. When they take the wisdom tooth out, just come in and take the tissue off of the second molar so it can come on up in the mouth, and we'll get the bands and stuff off, and the upper will come on down, won't be any problem. But up here I had them take the tissue off of that also. Now, let's see, now this is 1993, and she's 16 and 9, and we have in a wraparound retainer. Nothing goes across the occlusion on these cases. We keep retainer up above so the wire doesn't come across the occlusion. I still have these on here. We'll bond these teeth together right down here and put a fixed lower retainer in the mouth like that. but this is the finished stuff in 93. Let's see. I think there may be some more. And here just shows some of the work that we did. Excuse me. I use those little tiny brackets, and we've learned how to rotate the teeth. They're pretty difficult to rotate in, but we know how to put pads under them and rotate them. So I don't advocate you use them, but that's what I use. I like to have a lot of space in between here. Now these brackets that have these little wings are nice to use. Now that we've got good sealants you can put on the teeth. I used to get decalcification under those wings, but they've got a better sealant. I may have never gone to these, but I like those small brackets like that. Okay, now we're letting the bite finish up, but I don't have the finished stuff on this young lady. But we've got the palate now where they should start rounding this out, but she still has these ridges where she didn't get the tongue up in there good enough, but we got her teeth lined up pretty good over here. And this is about the finish of this, and everything's looking good. So again, there's the slicing technique showing you how we got those teeth in. This goes back further, but there's the second bicuspids. I mean, this is over the second. There's the second deciduous molars. There's where we did it. I've already packed that zinc oxide and used it all in there. Okay, I hope you enjoyed that and get something out of it. And we appreciate your joining our deal here and helping us out by becoming a member of our deal. So thank you very much for listening to this, and I'm going to say goodbye, and we spend too much time here on this. So I'm going to close out.